Subscribe to our channel, press the bell icon and never miss an update from Latestly.
Namaskar. Kemcho Bada. Majama. Thank you. Gujaratima Avine Mane Bohu Meja Avi. Thank you. Namaste. I have a special connection with India. I told this to His Excellency Prime Minister a number of times. I was taught by teachers from India in my high school years and later in university when I was studying biology. And in fact, I learned about traditional medicine in India from an early age through those teachers of mine from India. So the WHO Global Center for Traditional Medicine is not a coincidence. My Indian teachers taught me well also about traditional medicine, and I'm very grateful to them. By the way, I also grew up watching Bollywood films. And I understand that the Swiss Alps are a favorite destination for Bollywood fans. And the first film which I remember and which probably affected me like the Indian teachers of mine were Mamma India. The WHO Global Center for Traditional Medicine that we're launching will help to harness the power of science to strengthen the evidence base for traditional medicine. I'm grateful to Prime Minister Modi and to the government of India for their leadership in supporting this important initiative and the investment of $250 million to establish the center with an interim office, new location and building, and a 10-year commitment for operating costs. From the day I spoke to His Excellency Prime Minister Modi, his commitment was amazing. And I knew that this center would be in good hands. And that's what we're seeing. So thank you so much for your leadership, Your Excellency. This is a truly global project. 107 WHO member states have national governmental offices for traditional and complementary medicine. So this means India will go to the world and the whole world will come to India. Examples of traditional medicines being turned into modern medicines abound around the world, from throughout India, with such products as turmeric, neem, and jamun, and from indigenous communities in Brazil to the Kalahari Desert. But when it comes to how these products are identified, developed, and tested, and how the benefits are shared with the communities that nurtured them, on that, there is still much work to be done. Today marks a critical step in helping to bring the promise of traditional medicine to fruition, to the benefit of people around the globe. Helping to ensure that all people have access to safe and effective treatments is an essential part of WHO's mission. For many millions of people around the world, traditional medicine is the first part of call to treat many diseases. The new center will complement WHO's work on traditional medicine in headquarters, regional, and country offices. It will focus on evidence, data, sustainability, and innovation to support national policies and optimize the use of traditional medicine for health and well-being all over the world. Because traditional medicine is tied to the earth and the communities that have nurtured it, critical to the center's mission will be sustainability and equity, and the importance of respecting local resources and rights, including sharing intellectual property. The center's 5 main areas of work are: first, leadership and partnership in working with our global networks to support countries' research priorities for traditional medicine. Second, evidence and learning as we expand the knowledge base on traditional medicine, including with clinical trials and new holistic research methods appropriate to traditional medicine. Third, data and analytics. The 11th revision of the International Classification of Diseases by WHO will help to establish reliable data on the use of traditional medicine with the inclusion in WHO global surveys, including at the household level. Fourth, sustainability and equity for biodiversity, sociocultural resources, intellectual property, and other issues. And fifth, innovation and technology, including an artificial intelligence project which has already started global mapping of patents and research, as well as links to the new WHO Innovation Hub. As WHO, universal health coverage is a top priority. At the same time, we recognize that countries face many challenges to provide essential health services for all people in a sustainable way. Traditional medicine has been an integral resource for health for centuries in communities around the world. It's still a mainstay for some with inequities in access to conventional medicine, but also because of their trust in traditional holistic knowledge, practices, and resources. WHO's traditional medicine strategy aims to help countries develop policies and plans to strengthen the role of traditional medicine based on solid science and evidence. Where appropriate, countries can integrate traditional medicine into modern health systems, especially at the primary health care level, and to promote its use by individuals and communities in holistic efforts to promote well-being. I know that India offers its citizens regulated services of Ayurveda, yoga, naturopathy, Unani, Siddha, Soa, Rigpa, and homeopathy. And the health workforce of registered Ayush practitioners is more than 800,000, which is almost equivalent to that of conventional medical practitioners. WHO is now working with the government of India as well as several other member states to study how this integrated approach has worked, including in health emergencies. In an ideal world, traditional medicine would be an option, a choice offered by a well-functioning, people-centered health system that balances curative services with preventive care in harmony with natural environments. In fact, the 2018 Declaration of Astana on primary health care took traditional medicine into account, and it can help countries on their path to universal health coverage. Improving equitable access to safe, quality, and effective traditional and complementary medicine services can both help to meet communities' needs and help to build culturally and environmentally sensitive primary health care. Traditional medicine is also part of the growing $1 trillion global health, wellness, beauty, and pharmaceutical industries. Over 40% of pharmaceutical formulations are based on natural products, highlighting the vital importance of conserving biodiversity and sustainability. In fact, the discovery of aspirin drew on traditional medicine formulations using the bark of the willow tree. The contraceptive pill was developed from the roots of wild yam plants, and child cancer treatments have been based on the rosy periwinkle. Thank you so much for agreeing to host this center. And indeed, as I said earlier, the world will come to India, Jamnagar, and India will also go to the world through traditional medicine. And I hope this will be one of the important things that will bring the world together, because it will have training component, it will have research component, it will have other things that will advance traditional medicine. Then maybe to my teachers, I will just, in respect of them, I will say a bit in Hindi. Namaste, मैं यहाँ आकर बहुत खुश हूँ. मेरे इंडिया गुरु जनों ने पारंपरिक चिकित्सा का परिचय किया है. I hope I said it well, but this is my respect to the teachers, to the all Indian teachers who have taught me and who have influenced me, to express my greatest respect and appreciation. And really glad to start this partnership with India also. Very important initiative that I hope, and I believe, not I hope, I believe will be a success. Abajo. Namaskar. Kemcho Bada.
WHO ने ग्लोबल सेंटर फॉर ट्रेडिशनल मेडिसिन इसकी स्थापना के लिए दुनिया में से भारत को चुना है, और अब भारत में से दुनिया के लिए इस दिशा में काम हो